full arch reconstruction or full arch replacement of teeth is really providing patients today with the ability to masticate their food better, to give them the confidence and smile that they didn't have before. Implant surgery is basically taking titanium screws and placing them under the gum into the patient's jaw to replace teeth. The exciting technology that we have today, though, to make this a more precise type of technique is known as guided surgery. We use this by taking CAT scans and using intraoral scanners, all of which we have in the office, and in collaboration with the other specialists in the office, namely prosthodontists, so the surgeon and the prosthodontist will communicate together and utilize this information to make it more precise and more specific to each patient. And what it does is allows us to perform the procedure with greater accuracy. The guide is something that's developed through a digital scanner and CAD scan, and it's a template that's used to precisely place each implant. We place it into the patient's jaw, oftentimes without even opening the gums, over the gums itself, and then placing the implants through the guide, we're able to avoid certain anatomical structures that we need to be careful about, such as nerves or sinuses or even teeth in some cases. The overall techniques involved and the overall process lends itself to being a more accurate, precise technology. And the bottom line is that we're able to fabricate teeth for the patient that will give them a better end product and make this process as simple and as painless as possible.